Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
I'm on Ashwagandha for almost 10 weeks now because my sleep rhythm is pretty problematic. It goes a bit on and off. Some nights are good, but most of the nights are pretty bad. So I started with that. We had contact in the messages under the module about it. I'm taking 300 milligram at mealtime. And I know it takes a long time to get the sleep regulated. So I'm 10 weeks taking it and it's still irregular. So that's my question. So do I have to higher the dose or do I take it on not the right time? I do it at mealtime now, or what can I do with this?
Yeah, I mean, these are all good questions. And I mean, sleep is one of the major factors that so many people deal with. And it can be pretty challenging to address and treatment resistant in some cases. So, a couple things. Number one, to answer your question directly, ashwagandha has a number of beneficial effects on sleep, specifically helping to lower excessive levels of cortisol. It also has some evidence to show that it decreases anxiety because it has a calming effect. However, if those two issues are not the reason why you can't sleep, then maybe ashwagandha is not the right herb for you. But before you move on past it, I think the literature shows that anywhere between 300 and 600 milligrams is what the evidence-based dose is. And any herb is best taken away from food. So at least maybe 2 hours after. So if you're taking it after you want to take it for sleep, a good suggestion might be to take it, an hour before bed and 2 hours after eating dinner. So I think that would be a better absorption. And then maybe you could go up to the higher levels of the evidence-based dose range. But obviously trying to figure out why your sleep is problematic. If you've done the sleep hygiene, so you've cut out all screens and you've focused on doing mindfulness and deep breathing and those progressive muscle relaxation like was mentioned earlier. If you've done all those things and then also added in some physical exercise during the day and natural light exposure in the morning, because that sets your whole circadian pattern up.
I've done all those.
You've done all that.
I'm pretty committed. So I've done all these things. I go outside,
Okay.
I do all the mindfulness and other the breathing stuff. My cortisol was sub high, but that's 10 weeks ago. So that's why I started the ashwagandha. So I do all the stuff. The only other thing is that my hormones are low, the estrogens. My cycle is a bit irregular. It's not off. It's just there's more weeks in between. And the family doctor said you're just in a menopause. I'm 47, and so that's I don't know. You can also take hormones because with menopause, women are also getting sleep difficulties.
Yes.
I'm not so keen on taking hormones, so that's the thing.
Yeah, I'm glad you brought this up. If you don't mind me asking, do you have trouble staying asleep or falling asleep?
Falling asleep is a problem, and most of the time I wake up around 3 or 4 at night, and I'm tired when I have to go out. Like 8 o'clock, I'm tired, but that's where my day should start.
Right. Okay. And so, when you wake up in the middle of the night, what wakes you up? Is your mind racing? Do you have to urinate and you can't get back to bed? Are you hot? Is there a night sweat? What's happening?
Mostly just when I fall asleep, I sleep very deep, and then at 3 or 4 I wake up, mostly for toilet. or I don't know, the dreams are too strange, and I wake up because of that.
Okay. So there's vivid dreams. Is there some specific things that are reoccurring with your dreams?
Uh, I know and I don't really know. I don't remember all this stuff,
Mm.
but
Well, I guess the reason I'm asking is that there's a number of factors that can be contributing to poor sleep. So, one of them is elevated levels of cortisol. Uh, Maybe we talked about changing the dose a little bit. So that's one aspect of the ashwagandha. There's a number of other ingredients that help calm the brain and support lower cortisol levels. I can just share with you some of the evidence behind a couple of my other commonly used ones in my practice. One of them is called phosphatidylserine. Phosphatidylserine. I can put the name in the chat in a moment. There's some evidence to show that it helps lower cortisol spikes overnight. It is a type of fat, so it's a fatty acid, and it actually has some brain beneficial effects as well because of how we know how important fat is for brain function. So that is another substance. There's another one called magnolia that has, and then there's a combination of a number of herbs called relora, and relora is a patented combo. And again, it has complementary cortisol lowering effects. Secondly, we talk about in the Concussion Fix course about melatonin and the importance of that with sleep initiation specifically. Have you tried that?
I haven't tried that one. Melatonin.
Yeah, melatonin. So go back to the supplement section. I've talked about it a number of times. We even had, I think I've done a number of extra live modules on sleep. So I talk about melatonin in more detail. Melatonin is secreted by our brain through the pineal gland, which is our circadian pattern control, hormone control center, and it is very responsive to the light that we get during the day, and then that subsequently and reflexively produces melatonin at night. So sometimes after a concussion, the pineal gland doesn't function as well with the secretion of melatonin, and melatonin has lots of evidence for actually use after a concussion because of its brain antioxidant effects. So taking that an hour before you go to bed helps kind of set the circadian pattern up. And then the last thing I'll say, so again, we have cortisol, melatonin. Magnesium is really helpful when you take it before bed. We've talked about this in the course as well. Sometimes magnesium glycinate, the amino acid glycine, is really helpful because it has a calming effect. And then there's a type of magnesium I talk about in the course called magnesium L-threonate. It is the brain-specific type of magnesium, and some of my patients say that really is helpful for falling asleep. So there's some evidence on getting into the central nervous system better. But magnesium, with majority of what you take before bed, like in the evening, can sometimes patients will say to me that they get a much deeper and more restful sleep. And then finally, the hormones. So I know a lot of people are hesitant about hormones. There's a lot of, I would say, conflicting and even misinformation about hormone and hormone replacement therapy. If you try all these different things, then I think hormone replacement therapy is an option that I think is safe in the short term for people to use to help restore a lot of the dysfunction that happens, not just after post concussions, but also the changes in hormonal cycles that happen in the perimenopause and premenopausal time. There's no supplements, there's no diet that can make up for the lack of estrogen and particularly progesterone, actually, which is a very calming hormone. So I'd maybe consider that if you've put into place all the other things that I've just shared.
Mhm. And then, the thought of, when you haven't been sleeping for so long, there's got to be a bit of underlying stress to it. So it can always just be a bit of a self-assessment or question to yourself, hey, am I really feeling these effects? Am I stressing about it? Because it always, flares things up more. And I always share with people, even just the self-talk around sleep or how you're looking at sleep can be helpful when you're struggling with sleep. So for example, even beyond sort of the mindfulness and the work that you're doing with some of the mindfulness exercises, thinking about, okay, so I'm going to make sure I'm in bed by 10 o'clock, but I'm stressing for 2 hours before I go to bed, knowing that I'm going to have trouble falling asleep. And so just kind of asking yourself, does that happen for you? And if it does, seeing if you can invite sort of a shift in mindset where it's like, I still go to bed at 10 o'clock. If I fall asleep, great. If I don't fall asleep, that's fine. But what I'm going to do when I lie in bed at 10 o'clock is think about or do a few things that can support a restful state. So for example, playing a mindfulness track or a meditation track, playing an audiobook that is calming. The sound of it is calming, or maybe a sleep story. I know those adult sleep stories are actually really popular right now. Things like this can just support our nervous system to say, hey, even if I don't fall asleep right now, I'm also not stressed about falling asleep. And that makes a big difference as far as when we're going to fall asleep, how our body is supported when we do fall asleep. So you can think about whether there's any sort of subtleties going on underneath the surface around, am I stressed about not falling asleep when I get to bed? Same thing when you wake up around 3 o'clock is, are you stressed about the fact that you're awake? Are you worried about it, right? Am I going to be able to function tomorrow? I have all these things to do. Or is this bad for my health? Or am I going to get another setback in my concussion? These are really common thoughts that can happen when you're struggling with sleep. I'm kind of putting words in your mouth, so I'm not sure if that's happening for you. But generally speaking, this does happen, right? We're up in the middle of the night, especially if it's happening every night. We might really feel distressed about this. So really seeing if you can invite that mindset shift to say, oh, okay, I'm up again. How can I promote a restful state? Can I make, it feel really cozy in bed? Extra pillows or a nice scent in the room, something that helps support a restful state, even if you're not sleeping. So that goes a long way as far as your nervous system and just supporting your body to feel restful, even if you're not sleeping at that time. So hopefully that might be helpful too.
Yeah, I when I'm really stressed at night, I always have to think about your exercise. This is a moment of suffering, and then I'm doing that one. And the funny thing is that the body reacts on it now because I've done it so often. So yeah, I'm thinking a lot about the mindfulness stuff you offer. So
yeah, that line's from one of the self-compassion practices, right?
Yeah.
This is a moment of suffering. Suffering is a part of life. Can I be kind and gentle to myself in this moment of suffering?
Yeah, that one's really helpful, but it always makes me smile as well because it's funny. It's just
it is funny, yeah.
It's not, but it's a moment of suffering. So
even just as you said it there, right? Changing the tone of how you say it in like a funny voice or a character voice. These things can actually brighten our mood and like actually relax our nervous system and calm our nervous system down. So sometimes even just, saying these things in funny voices to ourselves can really just, rest the body and help us just kind of, okay, this isn't going the way I planned. It is a moment of suffering, but maybe if I add a little bit of humor, I can also relax a bit more.
Yeah, thanks a lot.
Thanks for sharing.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.